Hi everybody, welcome to Beauty Buzz with Lori. So today we have Dr. Garcia as our special guest. Thanks for joining us today.
My pleasure.
One of the things that I wanted to talk to you today that we get a lot of questions regarding is facial symmetries. So I'm just going to start off by asking you, are we symmetrical beings in the first place?
Right, that's a very common question. I get that question a lot in the context of consultations and in the context of post-surgical recovery. The face is never symmetric, just like the rest of the body, it is never symmetric. If I can use an analogy, whenever you buy a pair of shoes, it's the same size shoe, but they seem to fit differently on one foot and the other. If you take your wedding ring from one hand and put it on the other, they fit differently. So the body inherently is asymmetric. So the face is also asymmetric. The face is formed by two independent structures coming together in the midline, but the operative term there is independent structures. When we're inside our moms, these two structures fuse and they come together, but because they form independently, they're different. Okay. Now, hopefully, when these structures fuse, they fuse together in the middle, and there's never any problems with that, but there's always an asymmetry, and these asymmetries are manifested by, for example, one cheekbone being higher than the other, or one eyebrow being higher than the other, or one ear being higher than the other. One cheekbone can be a little more prominent. Every part of the face has inherent asymmetries.
Okay, so then that begs the question, can we correct asymmetries in the face?
Yeah, that's also another good question, and I always tell patients that unless the asymmetry is disfiguring, we don't go after asymmetries, because the risk to reward ratio with trying to fix asymmetries is too high. We typically, if we try to correct an asymmetry, we will typically overcorrect and cause an asymmetry in the other direction.
Okay.
So in my practice, the way I handle asymmetries is with counseling, and I tell patients, we really try not to correct asymmetries. Now, if I feel that one eyebrow, for example, is way higher than the other, and it is a disfigurement issue, then yeah, we will try to make the other eyebrow, the lower eyebrow, higher. But there is kind of a box where we stay within in terms of correcting asymmetries. But I will also draw to your attention the fact that the most beautiful faces on the planet, the people that we believe are beautiful, are asymmetric. If you think of your favorite, most beautiful Hollywood actor or actress, they have a favorite side. There's a side that they like to be photographed on and a side they don't like to be photographed on. And that's because they are asymmetric, yet that doesn't take away from the fact that they are extremely attractive people.
So with that said, are there other things besides DNA that can cause asymmetries in the face?
Sure. Trauma is a very common cause of asymmetry. The way that we age is also something that causes asymmetry. Sometimes I find people age a little quicker on one side of the face than the other. Okay. And the aging process is not related to skeletal issues or genetic issues. It's just due to the fact that maybe one side of your face has gotten more sun exposure throughout your life as compared to the others. So yeah, there's always external influencers in that asymmetry issue.
Okay, all right. Well, I know I learned some things today. Hopefully you did as well. Thanks for watching.